DIR fees, DIR fee stands for direct and indirect remuneration. Again, I'm going to come back in answering this question to the federal any willing provider law. PBMs know that with respect to Medicare claims, and DIR fees only relate to Medicare, only relate to Medicare. And a DIR fee is essentially a PBM taking between 3 and 10% of the aggregate drug cost. And as you know, the margins on specialty drugs are much less than in retail drugs. And there's also a different cost structure for specialty drugs. You need nurses and prior authorization, and they're expensive drugs, expensive to buy and maintain. So a few years back, probably in around 2015, one PBM in particular figured out we can no longer compel that oncology practice to turn that script over to our specialty pharmacy. We can't do it because there's this federal any willing provider law that prevents that from happening. And so PBMs figured out, instead of taking that prescription, let's just take the gross profit that we would have earned if we dispensed that drug. And so PBMs started DIR fees. One really started it, and the rest followed. The DIR fee essentially removes almost all the profit margin. And this is a shame because many oncologists that I've spoken to want to dip out of Medicare Part D. These are obviously our nation's older folks. They're vulnerable, and the cancer patients are obviously sick, and they want to go where they want to go. If they want to go to PBM-owned specialty pharmacy, let them do that. But if they want to go to the oncologist practice should be able to earn a reasonable fee. And that reasonableness is actually built into the law. The federal any willing provider law is a statute. There's also enforcing the Code of Federal Regulations, which is regulation. And there's also CMS has created a Medicare manual. They actually have a manual. And that manual says that the reimbursement rates for all Part D drugs has to be reasonable. And the terms and conditions have to be reasonable and relevant. So when a PBM takes all your profit, is that reasonable? And we won an arbitration against a PBM, and the arbitrator said, no, that's not reasonable. It violates the law.